ಮುಂದಿನ ಸ್ಟಾರ್ಟ್ ಮಾಡ್ಬೋದು.
ಶುಕ್ಲಾಂ ವರದರಂ ವಿಷ್ಣುಂ ಶಶಿವರ್ಣಂ ಚತುರ್ಭುಜಂ ಪ್ರಸನ್ನವದನಂ ಧ್ಯಾಯೇತ್ ಸರ್ವವಿಘ್ನೋಪಶಾಂತಯೇ. ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ ಹಾಗೂ ಶುಭೋದಯ. ಬೃಂದಾವನ ಪ್ರಗತಿ ತಂಡದ ಪರವಾಗಿ ಮತ್ತೊಮ್ಮೆ ತಮ್ಮೆಲ್ಲರಿಗೂ ಸ್ವಾಗತ ಸುಸ್ವಾಗತ. ಇವತ್ತಿನ ಕಾರ್ಯಕ್ರಮ ಮತ್ತೊಮ್ಮೆ ಆರೋಗ್ಯದ ಬಗ್ಗೆ. ಸೊ ನಾವು ಪ್ರಗತಿ ತಂಡದಲ್ಲಿ ಆರೋಗ್ಯಕ್ಕೆ ಒಂದು ಪ್ರತ್ಯೇಕವಾದ ಸ್ಥಾನವನ್ನು ಕೊಟ್ಟಿದ್ದೀವಿ. ಈಗಾಗಲೇ ನಿಮ್ಮೆಲ್ಲರಿಗೂ ತಿಳಿದಿರೋ ಹಾಗೆ ಪ್ರತಿ ಶನಿವಾರ ನಾವು ಯೋಗ ಹಾಗೂ ಧ್ಯಾನ ಇತ್ಯಾದಿಗಳನ್ನ ನಿಮ್ಮ ಮುಂದೆ ನಾವು ತಗೊಂಡು ಬಂದಿದ್ದೀವಿ. ಅದರ ಜೊತೆಗೆ ಇವತ್ತು ನಾವು ಈ ಕೋವಿಡ್ ಲಸಿಕೆ ಬಗ್ಗೆ ಒಂದು ಕಾರ್ಯಕ್ರಮವನ್ನ ತಮ್ಮೆಲ್ಲರ ಒಂದು ಇನ್ಫಾರ್ಮೇಶನ್ಗಾಗಿ, ಮಾಹಿತಿಗಾಗಿ ಹಾಗೂ ತಮ್ಮೆಲ್ಲರ ಒಂದು ಬೆನಿಫಿಟ್ಗಾಗಿ ಪ್ರಸ್ತುತಗೊಳಿಸ್ತಾ ಇದ್ದೀವಿ. ಇವತ್ತಿನ ಈ ಕಾರ್ಯಕ್ರಮವನ್ನ ನಡೆಸ್ಕೊಳ್ಳೋದಿಕ್ಕೆ ನಮ್ಮ ಮುಂದೆ ನಮ್ಮ ಡಾಕ್ಟರ್ ಆದಂತ ನಮ್ಮ ಡಾಕ್ಟರ್ ಬ್ಯಾಂಗ್ಳೂರ್ ಅವರು ಪ್ರಖ್ಯಾತವಾದ ವೈದ್ಯರೇ ಅಲ್ಲ, ನಮ್ಮ ಬೋರ್ಡ್ ಆಫ್ ಟ್ರಸ್ಟಿಯೂ ಸಹ. ಸೊ ಡಾಕ್ಟರ್ ಬ್ಯಾಂಗ್ಳೂರ್ ಅವರೇ, ತಮಗೆ ಸ್ವಾಗತ ಸುಸ್ವಾಗತ. ಥ್ಯಾಂಕ್ ಯು ಸೋ ಮಚ್. ನಿಮ್ಮ ಒಂದು ಸಮಯವನ್ನ ನಮ್ಮೊಂದಿಗೆ ಒಂದು 1 hour ಇವತ್ತು ಸ್ಪೆಂಡ್ ಮಾಡಿ ನಮ್ಮ ಸದಸ್ಯರೆಲ್ಲರಿಗೂ ನೀವು ಸಾಕಷ್ಟು ಮಾಹಿತಿ ನೀಡ್ತೀರಾ ಅಂತ ನಂಬಿದೀವಿ. ಈಗಾಗಲೇ ತಾವೆಲ್ಲರೂ ಸಾಕಷ್ಟು ಪ್ರಶ್ನೆಗಳನ್ನ ಕಳಿಸ್ಕೊಟ್ಟಿದ್ದೀರಾ. ನಿಮ್ಮೆಲ್ಲರ ಮನಸ್ಸಲ್ಲಿ ತುಂಬಾ ಒಂದು ಪ್ರಶ್ನೆಗಳಿದೆ ಅಂತ ಗೊತ್ತಾಗಿದೆ ನಮ್ಗೆ. ಪ್ರತ್ಯೇಕವಾಗಿ ಇವಾಗ ಈ ಕೋವಿಡ್ ವ್ಯಾಕ್ಸಿನ್ ಬಂದಿದೆ, ಅದನ್ನ ತಗೋಬಹುದಾ, ತಗೋಬಾರ್ದಾ, ತಗೊಂಡ್ರೆ ಹೇಗೆ, ಏನು ಅದ್ರದ್ದು ಸೈಡ್ ಎಫೆಕ್ಟ್ಸ್ ಇರುತ್ತಾ ಇತ್ಯಾದಿಗಳು ಈಗಾಗಲೇ ನೀವು ಕಳಿಸ್ಕೊಟ್ಟಿದ್ದೀರಾ. ಹಾಗೆ ನಮ್ಮ ಒಂದು ವಿನಂತಿ ಏನಂದ್ರೆ, ಫೇಸ್ಬುಕ್ ಅಲ್ಲಿ ನಾವು ಲೈವ್ ಇದ್ದೀವಿ, ಯೂಟ್ಯೂಬ್ ಅಲ್ಲೂ ಲೈವ್ ಇದ್ದೀವಿ. ನಮ್ಮ ಟೆಕ್ ಟೀಮ್ಸ್ ತುಂಬಾ ಶ್ರಮ ಪಟ್ಟು ನಿಮ್ಮೆಲ್ಲರಿಗೋಸ್ಕರ 2ರಲ್ಲೂ ಲೈವ್ ಸ್ಟ್ರೀಮ್ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. ತಮ್ಮ ಒಂದು ಏನೇ ಪ್ರಶ್ನೆಗಳಿದ್ರು ನೀವು ಅಲ್ಲಿ ಚಾಟ್ ಮೂಲಕ ನಮಗ್ ತಿಳಿಸ್ಕೊಟ್ರೆ ನಮ್ಮ ಅರ್ಚನಾ ಆಚಾರ್ಯ ಅವರು ಇವತ್ತು ಈ ಕಾರ್ಯಕ್ರಮನ ನಡೆಸ್ಕೊಡ್ಲಿಕ್ಕಿದ್ದಾರೆ. ಅವರು ಡಾಕ್ಟರ್ ಬ್ಯಾಂಗ್ಳೂರ್ನ ಕೇಳಿ ನಿಮ್ಗೆ ಉತ್ತರನ ನಾವು ತಿಳಿಸ್ಕೊಡೋಣ ಅಂತ ಹೇಳಕ್ ಆಸೆ ಪಡ್ತಾ ಇದ್ದೀನಿ. ಯಾವುದೇ ತಡ ಮಾಡದೆ ಇವಾಗ ನಾನು ನಮ್ಮ ಕಾರ್ಯದರ್ಶಿಯಾದ ಶ್ರೀಮತಿ ಅರ್ಚನಾ ಆಚಾರ್ಯ ಅವ್ರನ್ನ ಕರೆ ಹೇಳಲು ಇಷ್ಟಪಡ್ತಾ ಇದ್ದೀನಿ. ನಮಸ್ಕಾರ ಅರ್ಚನಾ.
ನಮಸ್ಕಾರ ಪದ್ಮಿನಿ ಅವರೇ, ಥ್ಯಾಂಕ್ ಯು ಸೋ ಮಚ್. ನಾನು ಅರ್ಚನಾ, ಎಲ್ರಿಗೂ ನಮಸ್ಕಾರ. 2019ರಲ್ಲಿ COVID-19 ಆರಂಭಗೊಂಡು ಮುಂದುವರೆದು ಪ್ರಪಂಚದೆಲ್ಲೆಡೆ ಎಲ್ಲರ ಬದುಕಿನ ಶೈಲಿಯೇ ಬದಲಾಯಿತು. ನಾವೆಲ್ಲರೂ ನೋಡ್ತಾ ನೋಡ್ತಾ ಕೋವಿಡ್ಗಾಗಿ ಲಸಿಕೆ ಲಭ್ಯವಾಗಿದೆ ಅಂತ ನಿಮ್ಗೆಲ್ರಿಗೂ ತಿಳಿದಿದೆ. ಇವಾಗ ಟಿವಿ, ಗೂಗಲ್ ನಲ್ಲಿ ಕೋವಿಡ್ ವ್ಯಾಕ್ಸಿನ್ ಇಸ್ ಟ್ರೆಂಡಿಂಗ್ ನಾವ್ ಎಂದು ನಿಮ್ಗೆಲ್ರಿಗೂ ಗೊತ್ತಿದೆ. ಆದ್ರೂ ಪ್ರತಿಯೊಬ್ಬರಿಗೂ ಪದ್ಮಿನಿಯವರು ಹೇಳಿದ ಹಾಗೆ ಹಲವಾರು ಪ್ರಶ್ನೆಗಳು ಇರುವುದು ಸಹಜ. 2020ರಲ್ಲಿ ಬೃಂದಾವನದೊಂದಿಗೆ COVID-19 ಸಂಭಾಷಣೆಯು ನಮ್ಮವರೇ ಆದ ಡಾಕ್ಟರ್ ರಾಮ್ ಬ್ಯಾಂಗ್ಳೂರ್ ಅವರೊಂದಿಗೆ ಆರಂಭವಾಯಿತು. ಇಂದು ಅವರೇ ಸೂಚಿಸಿದ ನಾಮಧೇಯ ಕೋವಿದಾಯ, ವೆಬಿನಾರ್ ಆನ್ ಕೋವಿಡ್ ವ್ಯಾಕ್ಸಿನ್ಗೆ ನಿಮಗೆಲ್ಲರಿಗೂ ಆದರಣೀಯ ಸ್ವಾಗತ. ಇಂದು ನಮ್ಮೊಂದಿಗೆ ಬೃಂದಾವನ ಅಲ್ಲದೆ ಬೇರೆ ಬೇರೆ ಕೂಟಗಳಿಂದ ಶ್ರೋತೃಗಳು, ವೀಕ್ಷಕರು ಭಾಗವಹಿಸುತ್ತಿದ್ದಾರೆ. ಹಾಗಾಗಿ ಕನ್ನಡದ ಜೊತೆ ಇಂಗ್ಲಿಷ್ ನಲ್ಲೂ ಸಂಭಾಷಿಸುತ್ತೇವೆ. Now a brief introduction on Dr. Ram Bangalore. Dr. Ramurthy Bangalore from Edison. Wait, what? Oh, that's true though. He has made New Jersey feel like Bangalore for a lot of us. He has been practicing internal medicine, pulmonary medicine, sleep medicine for the last 26 years and has held many directorial positions at quite a few hospitals in New Jersey. He is a consultant for pulmonary, sleep, and hospice palliative care at JFK Medical Center, Edison, New Jersey, Raritan Bay Medical Center, Perth Amboy, New Jersey, Robert Wood Johnson University Hospital, Rahway, New Jersey. But we know him as a doc who's always giving back to the community. Some of those include, but not limited to, community education on sleep apnea, administering free flu vaccination for the uninsured every year for the past 5 years. Brindavana has always been able to reach out to him with many medical queries, not just for residents here, but many visiting families as well. Rightfully, he has been the recipient of many awards, including honorary Doctors Beyond Call in recognition of philanthropy, charity, service, and outstanding success by Asian Indian Chamber of Commerce, the Bharat Gaurav Award presented by the then Indian Central Energy Minister S.K. Shinde, the Asian Leadership Award by Willens, Goldwyn, and Spitzer, National Citizens Overseas Award by Honorable former Prime Minister P.V. Narasimha Rao, outstanding service as a member at large of Medical Dental Staff Executive Committee. Sir, it is an honor for all of us for you to address our community today. Without further ado, over to you, Dr. Bangalore.
Thank you very much for your kind words. ಇವತ್ತು ಸ್ವಲ್ಪ ಕನ್ನಡ ಸ್ವಲ್ಪ ಇಂಗ್ಲಿಷು ಎಲ್ಲ ಮಿಕ್ಸ್ ಮಾಡ್ತೀನಿ. ಈ ಟಾಪಿಕ್ ಕೋವಿದಾಯ ಅಂತ. ವಿದಾಯ in Kannada means goodbye. COVID vidaya. So we mix everything. We put it as we want to say goodbye to COVID. How we can say goodbye to COVID? That's the topic of the day. Today I'll be talking multiple issues regarding COVID, vaccination, disease process. Sometimes have to be telling in a layman's terminology, not becoming too much medical. Basically, we have a wide range of audience and we have to cover wide range of audience so that there may be children, some adults, some people may have medical information, some people may be engineers, they don't know anything about medicine. So in that respect, it has to be a general topic. However, I requested Padmini, our president, to share my email address to you. If you have any questions which is not answered during this conference, I'm more than happy to answer individually by email. I also want to thank Brindavana for giving me an opportunity to share my thoughts, my knowledge, and also be a part of during a crisis, how to deal with COVID. Most of the people ask me, hey, what is COVID? COVID is a virus. It's a respiratory virus. What I mean is, basically, it is a virus which affects the respiratory system. People who had exposure to COVID, they have runny nose, cold, fever. Sometimes they may have abdominal symptoms like diarrhea or abdominal pain. Now, what we have to do is, this is started in the year 2019, and it became a pandemic all over the world. Now, it's time for us to look at how to prevent COVID disease. Is there what's the new about the vaccination? If we take a vaccination, are we 100% safe? We are going to discuss various options. Today, if you know, today is the Super Bowl day. So the two teams are playing. One is Chiefs and Buccaneers. We don't know who is going to win. However, our topic of the day is your Super Bowl of your lifetime. We want all of us has to win this game. So my information, which I'm going to share it with you, is to help you to deal with COVID, to get better, and also learn something about vaccination. Now, people ask me, hey, what is a vaccine? How do we treat a disease using a vaccine? Question is, there are two kinds of vaccines. One is live, another is, it's one of the proteins from a virus, which we use that to create an immunity or an antibody reaction. Let me rephrase. Number one, virus has proteins on the body. Now, let me have a scenario. This is not a real COVID. Since I'm thinking about a COVID, I'm going to wear a gloves. This is the COVID, okay? Think it's COVID. So we want to know what is known as messenger RNA. It's a protein structure on the top of the COVID. So basically, this is the spikes are protein-like structures. We take these proteins and then we manufacture in a large quantities. And this is an antigen. What is an antigen? When the virus enters the body, it has something to stimulate the body, antigen. It creates a reaction. Antigen, when stimulates the body system, our body wants to develop immunity from this virus. We produce antibodies. Now, this COVID creates an irritation in the body. Now, when we inject the antigen intramuscularly, body recognizes, hey, there is something foreign to me. Let me fight this. To make it an analogy, say you have a store, you have an alarm system, a thief walks in, it tries to break in, thief is the antigen. Now, the alarm system is your body mechanism to fight it. It also calls the police. Police are the antibodies. So antigen is a protein-like structure from the virus, which gets into the body, triggers an immune reaction, and there's a memory, and the police were called to fight or catch the thief. Same way, the vaccine is an antigen. Now, when it is injected into the body, that creates a reaction in the body so that we develop antibodies to the elements which fight against the COVID disease. There are two ways of developing antibodies. Number one, if you have a COVID, I mean, we don't want anybody to get COVID. In case you get COVID, that itself can create an antibody, because the real COVID creates an immune system in the body that makes you to develop antibodies. That's one way of doing it. The other way is, suppose you get a vaccine. Vaccine is not live. It's like only a portion of the virus which is injected. It's not live. It does not give disease. That will trigger an antibody reaction to develop immunity for the COVID. At the same time, I'm going to take a lot of questions which has already been sent to me. So I'm going to summarize some of the questions, try to come up with the best of best answers. Questions number one. People ask me, is it a dead virus or is it a live virus? It's not a live virus, okay? The other question is, it was within a 1 year, they came up with the vaccine. Always a question comes up, hey, to get a vaccine, it takes many, many years. They have to go through a phase 1 trial, phase 2 trial, phase 3 trial. After 10 years down the line, they'll be able to come up with the vaccine after going through the various trials, because they might start on a smaller population, then go to a bigger population and try to come up with, look at the side effects, and if at any, document them and also advise the public on this. However, we could not do that, a long time trial for COVID. The reason was, it was such a devastating disease. A lot of people were dying, a lot of people were suffering. So CDC, Center for Disease Control, and World Health Organization came up with what is known as emergency authorization. Hey, we don't have all the information. We want to get basic information so that we can have the vaccine, and then we give the vaccine. That was the reason it was approved within 1 year, less than a year. The reason it is approved less than a year is to save many, many, many lives. And it has been already in market for almost 6 to 8 weeks. I've seen a vast difference compared to people are getting vaccine. Even the incidence of hospital admissions are coming down. The way it looks like is, if 70% of the population gets vaccinated, I'll repeat, 70% of the people gets vaccinated in the community, it will build up what's known as herd immunity. Herd means, hey, everybody is immune, so unlikely we pass it on to the other person. So with that in mind, I strongly recommend that everybody who is eligible should get vaccination. Talking about vaccination, there are subgroups of people whom we don't recommend vaccination as of now. The reason is, so far we are collecting the information in different groups of people and find out who are the right people, or who should get it, who should not get it. And again, Center for Disease Control, CDC from Atlanta, World Health Organization, came up with a goal saying that, okay, let's vaccinate the highest risk people. Highest means the doctors who work in an ICU, CCU, the nurses, and the first aid employees. So those people has to be immunized first because their life is day to day, they deal with COVID. Now, being said that, they grouped as 1A, 1B, 1C, 1D. And then next group is anybody after the age of 65 who have underlying heart disease, diabetes, asthma, high blood pressure. They are the next group of candidates. And then it comes below 55. So the way it looks is everybody should get immunized. Everybody should get vaccination. There is no doubt about it. However, there is a prioritizing the group of people who gets vaccination. Being said that, there are subgroup of people where we do not have much information about whether they should receive vaccination. The reason is it's a developing science. This disease is new to us, and we are looking at why we don't have all the information. One is pregnant women. Somebody who is pregnant, at this time, we have very limited information whether they should receive vaccine. And at this time, they're not recommending. However, there is a very small number of people who is, suppose, a nurse. She's pregnant. She's working in an ICU, CCU. At that time, if she's pregnant and she's working in a high-risk area to develop COVID, there is a small option to discuss that with her primary caregiver and come up with an option. However, it's not mandatory. Same way, we do not recommending any COVID vaccine for children below age 16. Right now, it is 16 and above. The other subgroup of people is women who are breastfeeding. They are not recommending it until unless they are counseled and they belong to high-risk group. Being said that, I'm going to go over a few questions and I will elaborate most of it. The question is, okay, fine, I get a COVID vaccine. There are two COVID vaccines which is available in United States of America. One is Pfizer group, another is Moderna. These two vaccines are given 2 shots. Pfizer vaccine, shot number 1, then 21 days, they give the second shot. Moderna is also 2 shots, but it's given after 28 days. There's only difference is one is within 21 days, 3 weeks, another is 28 days. Both are equally effective, 90 to 95%, and they build up very good immunity. Suppose I get a first shot, I got it, and then you say, hey, how much immunity am I getting to get it? Usually 1 shot gives you 50% immunity. However, if you get the second vaccine within 21 days or 28 days, depending upon the vaccine, you develop 90 to 95% immunity. So one is 1 shot, 50%, other shot, second shot gives you 90 to 95%. The immunity usually starts 2 to 3 days after you get your shot, but you will develop an immunity, keeps on increasing over a period of few weeks. The other option is, another question came up, one of the questions from the audience is, hey, I get a vaccine, 1 vaccine, I have an emergency, I'm unable to take the second vaccine within 21 days, that is a Pfizer vaccine. Is it okay to delay for 1 or 2 days? Unusual circumstances, it can be done. However, we always want you to directly make sure you keep up with the rhythm of 21 days for Pfizer vaccine, 28 days for Moderna vaccine.
Dr. Bangalore?
Yes.
On a related note, somebody had a question over here. Say, let's assume they got this vaccination at a particular pharmacy. Maybe they got a Pfizer, but that seems to be so far away because that's where they got the appointment, either the pharmacy or one of those like COVID vaccination centers, and they are unable to, make it to the same place. So can they choose to go into some other pharmacy, local one that is giving the Moderna one or something of that kind?
It's an excellent question, but the chances are so slim, number one. Two, suppose there is a situation where they took the first dose is Pfizer, second dose, can they get different? No, at this moment. The reason is there are all guidelines from Center for Disease Control, CDC Atlanta. They say, hey, if you get Pfizer, please make sure the second is also a Pfizer. Two, if you get Moderna, make sure the second is also Moderna. At this time, it's not recommended to change the vaccine brands because you are unable to get it. The only question I tried to answer earlier was, hey, you are delayed by 1 day or 2 days for extraordinary circumstances. So there's a big snowstorm. I'm still seeing it outside. Say like 10 inches of snow. I can't get out of the house. Fine, you can't help it. We prefer to keep same brand of vaccine so that we really know how the immunity is going to play. What's the other question? You can ask me.
The brand and the badge, would that matter in terms of like in Pfizer, when they usually give it, there's a particular number that they stamp saying that it's a particular
brand. The badge is only, it will tell, that's only for their investigational purpose. That's only for their filing purpose to look at the badges. However, badge does not matter this way. As long as it's Pfizer, stay with Pfizer. If it is Moderna, stay with Moderna.
Thank you so much. Another related question from Kajo. Just like you said, in case of inclement weather, just like today, if somebody was supposed to get a vaccine, and between Super Bowl and everything, there's no way they're going to get there. If they skip the particular dose on a particular day within the 21 days or 28 days limit, is there a window, wiggle room, before which they can still take the second dose? And what if they are not able to do it? What's going to happen? Do they have to retake it at some other point?
A good question. The way is, suppose there's a big snowstorm, you're watching Super Bowl. Super Bowl is more important than a COVID vaccine. I mean, I disagree with that, but if you decide to do that, I would say, hey, natural calamities, heavy snow, heavy traffic, you're not able, flooding, whatever it is, fine, you delay for a day or two. However, as far as I'm concerned, 99.9% of the people are sticking to their vaccine as of now. 21 days for Pfizer, 28 days for Moderna. However, rare circumstances, we will all say something is better than nothing. We want you to take it. However, stay with the same brand. Don't change the brand.
Okay. And in case right after the first one, they had an anaphylactic like reaction, like either Bell's palsy or anything of that kind, or just really bad, severe reaction, would you recommend that they should still take the second dose, or at that point, is it like a no?
Okay, question. Let me explain what is an anaphylaxis reaction. So suppose you go to a pharmacy or you go to a hospital where they are giving the COVID vaccine, you take the vaccine, you feel dizzy, it's so rare, it doesn't happen to everybody, it's so rare. So you feel dizzy, you develop a rash all over the body, a little low blood pressure. At that time, every place where they're giving COVID vaccination is equipped to take care of anaphylaxis. Anaphylaxis is body thinks, hey, you are something new to me. Oh, I don't like you. So that creates only an immediate reaction. That is well treated at the site. For example, you go for a COVID vaccine. They gave you the shot. They'll ask you, oh, Archana, can you please be seated here in front of me for next 15, 20 minutes? Don't get up. Don't go anywhere. I want to recheck you. So they do use what's known as observation. You go for a shot, they'll watch you for 15 minutes. You don't have to do anything. Read your own book, watch some news, but they want you to be in front of you for 15. Some people make you to wait for 30 minutes. Then, okay, goodbye, go. Then I'll ask you, do you feel good? Anything bothers you? No, I'm fine, I'm leaving. That's it. Chances are very slim. Suppose they have an anaphylactic reaction. It's a reaction because of the vaccine. It's so rare. There are medicines to take care of it. The other follow-up question on that is, hey, somebody gets said, oh, well, let me go back. Anaphylaxis is so rare. It does not happen to everybody. People, what is the common side effects? That's most important than anaphylaxis. It's like winning a lottery. It's anaphylaxis. Everybody don't win a lottery. So let's talk about common things first. Common things. Number one, you may have a little soreness at the place of the injection. They are given inside the muscle, intramuscularly. Two, some people may develop a little redness in the area. Today, you may develop some shoulder pain, joint pain, low-grade fever, little uneasy. Fine. That's it, gone. Other thing is, between the two shots, first shot and the second shot. First shot is less likely to have any side effects, even the soreness or anything. Second shot, when we give it, it's an antigen. Again, we are giving the same antigen. The body already knows, first, when you give the first shot, the body already produced the antibody. Thinking, hey, ready, if a COVID comes, I'm going to fight it. Now, when you give the second shot, body already has antibodies. You will have a little more reactions during the second shot, which includes low-grade fever, aches and pains, joint pain, and some kind of an uneasiness. However, what I recommend my patients is first shot, fine, 99% walk through it, nothing will happen. Second shot, take it on a Saturday so that you can have a day's rest if you can. Now, everybody is working from home. They're resting at home, quote unquote, apart from working from home. So we ask you to take rest on that day. So getting back to the original question, anaphylaxis is so rare. It is treated at the site of vaccination because after the vaccination, they want you to stay there for 15 to 30 minutes to watch for any side effects. I hope I answered your question.
Absolutely. And again, like piggybacking on the same question, are there expected long-term side effects of the vaccination? Have you ever seen or heard of something in the journals?
To answer a long-term side effects, it has to be there for long-term. Right now, it is so quick, so fast. They came up with a vaccine with 1 year because it's a life-threatening emergency. We don't know long-term effect. However, every time you get a vaccine, it's coded, and they are watching this side effect. And there is also, after you get a vaccination, they give you a card. You can have a contact with Center for Disease Control if you have any side effects. They are collecting those data. Say 4 or 5 years from now, they'll come up with an answer. Hey, this could be a last. This could be. We don't have enough data to say we do have long-term side effects at this time. However, over a period of few years, if there is any, we'll give to you. Before you leave long-term, you should go through the short-term, survive the short-term, you'll be there for long-term.
Okay. Thank you so much for the answer. Again, another question from Deepa. Once I take this vaccine, will I be totally immune from getting infected from COVID?
Good question. Now, COVID is a disease which is respiratory wise. Basically, if you sneeze, we want you to wear a mask, number one, use common cleaning ways, wash your hand with soap. When you come home, if you're working in a hospital, make sure to change your clothes, or even if you go outside, come back, wipe your hand, clean your hands, and make sure if you know somebody has COVID, patient has to be under quarantine. Make sure he is using he stays away from other people. Apart from using a mask, both parties has to use the mask. By using a mask, it is less likely it's going to be transmitted. That's one. Two, question. I got a COVID vaccine. Okay. Now I got 2 already, to be honest. Nothing happened to me. A little soreness, but I'm fine. If I'm going out to see a patient or see a friend, even though I keep 6 feet different distance, I need to wear a mask. Can I carry, or somebody who got a COVID vaccine can carry the disease? Answer is yes. Why I'm saying that is, even though the COVID will build up an immunity in you, COVID, suppose you are a carrier. Carrier means the virus lives in the back of the throat, in the pharynx and the nasal passages. You can be a carrier. You may not suffer from a disease, you can carry the disease. That's the reason it's so important. The younger population who are less likely or little reluctant to follow the rules and regulations may be potential carriers. So I will advise, still use the mask, you wear, keep a distance, that's the best way. And today's Super Bowl, please 6 feet apart and wear mask and watch alone. No, I won't say that. Watch with 3 or 4 friends, not too many people.
Okay. So basically what you're saying is we'll address quite a few questions from like, Rachna, Ritika, everybody has asked the same question. I think a lot of kids basically, can I stop wearing the mask? So basically till everyone achieves herd immunity or everyone ends up getting vaccinated, it's a good reason for us to continue wearing the mask and maintain protocols.
Correct. At this time, I will say probably to develop a 70% immunity in the herd immunity in the community, probably this vaccination, I'm talking about United States, will keep on going until June, July, August, maybe even September, so that 70% of them get the immunization. Then there's a herd immunity. There can be a little more relaxation at that time. However, at this moment, if you think somebody is having a COVID, please request that particular person to quarantine. You wear a mask, he should also wear a mask, and then you go step by step.
I think we have to go back to like one other question from Shubha Shastri, because Johnson & Johnson is in the market, at least it's rolling out and everything, and it's saying it's 66% effective. Just for my own comfort zone, can I take another brand later? Would you recommend something like that? Or
if you stick with, as of now, the recommendation is from Center for Disease Control, it's not me. So the 2 big organizations, World Health Organization, WHO, plus CDC, Center for Disease Control, they're all recommending stick to one brand. You cannot change the brand. Second question, the Johnson & Johnson, they say it is 66% effective. However, please, I want to step back and tell you something. From last couple of months, I've treated multiple patients with COVID. I took care of a lot of people with COVID. When I treat them, 85% of them, they get better at home. Nobody is going to go into the hospital. The remaining 15% needs a special care in this. What has been found with Johnson & Johnson is, yes, even though, the good news is Johnson & Johnson is only 1 shot.
that's right. That was another question, basically. Which one would be better?
Hey, I don't want 2 shots, I want 1 shot. It has been known to reduce the incidence of severe disease. You follow what I mean? Severe means really life-threatening disease. So it does reduce incidence of life-threatening disease. As far as I'm concerned, the immunity you develop, it's you, and how much you can immunity develop. At this moment, as of now, I advise you to stick to one brand, do not change the brand. I still believe, depending upon, I think we are heading in the right direction as of now. If 70% gets immunized, we are going to win this war. That's my personal belief.
Okay. Moving on to, I think, side effects. We still have a whole bunch of questions from the listeners related to side effects. I think nausea and dizziness. Is that very common?
Very, very. The most common thing is soreness when they shoot the injection. Second is the anxiety of the shots. Okay, when you give shots, people look on the other side when they give the injection.
Right.
Anxiety, take over the anxiety, little redness, little irritation, soreness. That's 90%. Nausea, very uncommon. Dizziness, uncommon. You may have a low-grade fever after the second shot. But those things are not much common. Believe me, to have a minor side effect of a vaccine is far better than having a disease itself. So I have to look, which is a better devil. That's the way I look at it. I think the vaccination will play a major role to bring down the incidence of the disease, as well as help you to prevent a disease and fight the infection very nicely.
By the way, that question was from Pramila Balisagar. Next question from Malik. If I already got the COVID-19 or somebody has got the COVID-19 and recovered, do I still need to be vaccinated?
Absolutely. My friend Malik, they should get it, number one. The reason is, okay, people say, okay, that brings you a beautiful new topic. What is immunization and vaccination? Immunization means you can get a disease, you develop an immunity, or you get a vaccine, you develop immunity. Question is, somebody who has COVID, proven COVID, yes, nasal swab is positive, and also when somebody develops COVID, they also develop antibodies. Antibodies means just like giving a vaccination, they develop an antibodies. They fought the infection. Again, it's not my word. It's the word of Center for Disease Control, CDC. They are the most brilliant people, get together, come up with guidelines. Their guidelines is, please get the vaccination. They also say, hey, you can wait for a few months, 2, 3 months, maybe not more than 6 months to get the vaccination, but they still recommend vaccination for people who develop COVID or who had COVID, got better from COVID.
So I've heard that people have been recommended to wait at least 90 days to get the vaccine. At the same time, some other people, I think they were positive by Thanksgiving, and by December, when the first vaccine rolled out, they were given the vaccination as well. So is there any criteria as to why we have to wait 90 days or not, or whatever?
The reason why the Center for Disease Control came up with this game is, hey, if you had a COVID, absolutely, you fought the infection, you have developed antibody. Sometimes in my practice, you don't do it generally, somebody wants a COVID vaccine, somebody gets COVID, he gets better, he or she, I check a blood test to check the antibodies for COVID. If he has antibodies, that's kind of an assurance for the person, hey, you have the immunity at this time, there is no rush to go get your, give your sleeves up to get the shot, wait for some time before you get the shot. So basically, there is no real word in this, but what they're saying is, if you just recovered from COVID, please wait for 90 days before you get the shot. And that is well accepted around the world.
Okay. Usual question.
Yeah.
Will I still get COVID after I'm vaccinated?
Oh, good. Can it happen? It does not happen 100%. It may happen some percentage. We really don't know the percentage. Can it be 2%, 5%? We don't know. There is always a possibility of getting COVID, even if you get the vaccination. However, how bad it is, you can fight that infection better if you have a vaccination compared not having a vaccination. That's number one. 2, there is always a question. I have a person who had COVID vaccination. For some reason, he had a fever. We did a throat swab, nasal swab. It showed COVID. He didn't have no symptoms. What I'm trying to say is, people who get COVID vaccination develop immunity to fight the infection. It does not mean they won't be carriers to pass on to some other person. So can he have a real disease? I don't think it's going to be a major disease. It could be a subclinical inflammation for people who has received vaccine and developed COVID. Chances are slim. That's the reason we are saying, fine, vaccination is not the answer for everything. Still, social distancing, wearing a mask, hand washing is still going to play a major role.
Most of us feel like we are superhumans. So if I get the vaccine, can I still spread the virus to others?
Number one, we are not superhumans. We are humble people. We just want to say, hey, follow the protocol. Listen to the public health officials. Look at Center for Disease Control. Look at their recommendations. Number one, having the vaccination certainly prevents the incidence of disease. Number one, improves your immunity. Two, can you spread the disease? The only way to prevent spreading the disease is wearing the mask, as well as hand washing and keeping a 6 feet difference at this time. However, if this herd immunity is reached, 70% of the herd, hey, you have a little more freedom at that time. I think we are heading that way, but it may take August, September, or November of this year. That's my gut feeling. It depends upon people getting the vaccination. There is also a reluctance in small subgroup of population about vaccines. However, the best way is education and counseling, and listen to them and why they don't want it, and then appropriately deal with. So all the healthcare workers should do their honest attempt to convince the person they should get the vaccination in the interest of the whole community.
Question from Deepa. How long will my immunity to COVID-19 last? So basically the question, I'll piggyback with another question, random. Trust me, I mean, we've received quite a few anonymous questions. So I'm trying to put them all together.
Yeah.
So will there be an annual recommendation just like the flu shot?
Okay, 2 questions. Excellent question. If I know the answer, I won't be sitting here. I mean, that's a joke. What I mean is, we don't know how long. Suppose for example, I took my 2 shots and I did well. Nothing happened to me. The reason is we treat a lot of people in intensive care unit, CCU, and we are directly involved treating these people who are on a ventilator. So as a pulmonologist, we come under a category where imminent danger. So they gave a priority to us. So we took it. I took the shots, I came back, did a lot of research. How long the immunity lasts? Answer, we don't know. The reason is, it's such an acute disease happening right in front of you. I need to check my antibodies 6 months from now, 1 year from now, 2 years from now, and see whether my antibodies are still there. So I can answer this 2 years from now, how long it's going to last. Other question is, hey, just like a flu vaccine, we get a flu vaccine every year, September, October, November, December, January for the next year. Just like a flu vaccine, do we need a COVID vaccine every year? We don't know the answer, to be honest with you. We don't know the answer. As far as I believe, we'll better over a period of couple of months, by the end of this December or next January, we may have some answer. But right now, it's still, we are going through we are the part of the game. The game is not over. So we will know more about it next few months. I'll share it with you.
Thank you so much. Hemant Satyamurthy ಅವರು question ಕೇಳಿದ್ದಾರೆ. And Deepti as well. Will the currently available vaccine target all the variants that are being seen, or will it at least lower the intensity of the new strain if somebody gets infected?
Okay, the question is, it's a good question. I believe it has some effectiveness for different strains. There are 2 strains they're usually talking. One is a UK strain, another is a South African strain. I believe it will bring down the intensity of the disease, okay, at least, I'm sure. And it has been proven effective irrespective of the variant of the COVID. So majority of the COVID is some groups, South African variant and UK variant, it is still effective.
Okay. You have answered most of these questions related to that. I'm sure there'll be a lot of repetitive questions related to the topic here. Women of childbearing age or pregnant, nursing, can they get the vaccines? I know you'd mentioned, but just in case, I mean, this question just came up.
The woman who is pregnant at this time, not recommended until unless she's a healthcare worker, she's a nurse, she's working in intensive care unit. Every day she's taking care of COVID patients. So those days where I was seeing 40 to 60% of the hospital was filled with COVID patients. Just imagine, those days are gone, things are better. So at this time, if is a nurse, she's pregnant and she's a high-risk health worker, now there's a counseling is done. Counseling means at this time, Center for Disease Control is not recommending for pregnant ladies. However, healthcare worker, a counseling is done between the primary care provider and give the options. Hey, we don't know long-term side effects of giving a vaccine in a pregnant lady. We don't know. However, you're a healthcare worker, you're pregnant. Can we have a discussion? Then healthcare worker and the patient discuss together and weigh the risk and benefits and make a decision. That's the answer at this time. Generally, we don't recommend for pregnant women who are not healthcare workers or high-risk group.
Okay. Will COVID-19 vaccines cause you to test positive on COVID-19 test in general?
Answer is no. The one is, it is the COVID testing is done from a saliva or a swab from the throat. They look a different thing. If you get a COVID vaccination, you build up an antibody. That's totally different. So COVID vaccination will not make you to turn positive for COVID testing until unless you are carrying a disease as a carrier. Oh, that's very important. There are subgroup of people carry the disease in the throat, but don't suffer from the disease. I have few patients. Hey, doc, I've been positive for 3 times, but I don't have no symptoms. They're called carriers. They can transmit to others, but they won't suffer. There's a small subgroup of people. So they could be carriers. It has no connection between the vaccination and turning positive on COVID testing.
Okay, I think that kind of answered Mr. Prakash Trivedi's question. If anybody gets positive asymptomatic COVID-19, should have to get vaccine immediately, or do you think they should have to wait for their turn?
Good. Asymptomatic person who is COVID positive, correct? He doesn't have symptoms, he's carrying it. I think he should wait his turn, number one. So again, we have the priority, senior people, healthcare people, police, Homeland Security. Next, nursing home population. They are very high risk for COVID. It can transmit like this. Nursing home population, 75 and above, 65 and above, blood pressure, high blood pressure, asthma. Next, you get the next group of people. So the government CDC has some clear-cut definition saying that who are the people who should get it first, who are the next in line, who is next in line, and they're doing very well.
Very good. For the side effects and everything, can they take any kind of medications? Related to that, I will also ask you, Usha Oro has asked, can I take B12 in between the 2 vaccination shots doses that I'm going to get?
Okay, what we usually is, what is recommended is, suppose I'll tell you my own example. So I took shot 1, I felt little uneasy, I took rest that day. Second shot, 21 days, I had a little soreness, low-grade fever. I took Tylenol, I just relaxed, went away, very next day. Question is, you have a COVID vaccination today, my next COVID is 21 days. In between, I had to take monthly B12 injection. Okay, fine, go for it. It doesn't hurt. However, what I'm trying to say is there are some group where we don't want to combine 2 vaccinations. For example, patient is here for a COVID vaccination, give the COVID vaccination. You want to know whether there's any side effect. If there's any side effect, how to treat. So sometimes they say, hey, doc, I'm already in your office. Give me a pneumonia vaccine here, COVID vaccine here. I won't do that to you. The reason is we prefer to space it out. 2 different vaccine which is required. He'll say, hey, not now, do it later. So B12 is kind of, it's only an IM injection. She can certainly take it. It has nothing to do with COVID. I won't give it on the same day because in case you get a reaction, you say, you don't know, is it B12, is it COVID? So at least for a week apart, we can be done.
So a whole bunch of questions related to the medication that people are already taking and everything. Before I go to the vaccination, do I need to stop my aspirin? Another question is people, from Mr. Vishwanath MB, people who are on steroid medication, can they opt out of taking the vaccination?
Good question. Aspirin. Aspirin is like, everybody is an aspirin. I don't think I'll stop the aspirin. Aspirin has a lot of protective effects, so I won't stop it. I will not stop the aspirin. People can continue the aspirin and should go take the injection. That's all. What was the follow-up question? The second?
Somebody who's on steroid medication for a long time, can they opt out?
No, especially when you're on steroids. People who are probably severe lung disease, chronic obstructive pulmonary disease, emphysema, smokers, they are steroids for some rheumatological disease, immunosuppressed. They are more immunosuppressed compared to general population. Long-term use of steroids can raise the blood sugar. Can you make you more prone for infection? I will call them more high-risk people than general population. They should and must get vaccination done to prevent a severe infection and to prevent a disease.
Okay. Similarly, Lakshmi Kollal ಅವರು ಅದೇ ತರ question ಕೇಳಿದ್ದಾರೆ. What are the precautions that I need to take for a long-term, diabetic if they have to get the vaccination?
Long-term diabetic precautions. Number 1, control your blood sugar. We monitor what's every 3 months a marker for diabetes, what's known as hemoglobin A1C. That means we measure a protein in the body. For example, you check your blood sugar, okay, 120. Suppose when you take out this protein it's a protein in the body which picks up the glucose particles. Suppose it is picking up too many glucose particles, it is more saturated. So we monitor a hemoglobin A1C. It's a protein in the body. It's a marker for diabetes. So we want to bring it down below 7. That will prevent you or help you to fight the infection. Make sure control your sugar.
I think we kind of have covered most of the questions for the general population. I just wanted to touch base a little bit on the pediatric questions. Rupa ಅವರು ಕೇಳ್ತಾ ಇದ್ದಾರೆ, can children be vaccinated? And if so, what are the COVID vaccine options available at this point? Again, I'll just piggyback a whole bunch of questions related to that. I believe there is a trial going on, for younger kids, the Xenoform vaccine and things like that. I just wanted to say, is that recommended? And again, if some child, let's assume 16-year-old or 18 or somewhere around that range, takes the COVID vaccine, will that cause misE?
Okay, 2 questions. Number 1, at this moment, as we speak, the guidelines coming out of World Health Organization, Center for Disease Control, they are not recommending vaccine for 16 and below. 16 and above, they're recommending. However, they are the last group to get a vaccine compared to 75 years old, 65 years old, elderly people, nursing home people, healthcare workers. They group as 1A, 1B, 1C, 1D. So they have a different groups. They're the lowest group. The question is, COVID vaccine, can it give that inflammatory syndrome? Okay, that is seen in children who develop COVID disease. It has not been tried in children. COVID vaccine as of now has not been tried in children. Even if it's very experimental. However, it's not recommended below the age of 16. MIS-C, it's a inflammatory disease seen in children, majority of the time. However, it also seen in elderly people because of the COVID infection, body gets into an inflammatory state. So they'll have bleeding, they have irritation of the heart, lungs, and other things. It's rare, but it has seen in children. It's also seen in adults. Children are more than adults, but COVID vaccine, I don't expect to give this kind of a inflammatory response in children, even when they decide to give vaccine to the children. At this moment, we are not giving it, and it's still under observation. And if it happens, we'll probably add on the information during the next session, if there is any.
Sunil Holikare ಅವರು ಕೇಳ್ತಾ ಇದ್ದಾರೆ, what precautions should families with young kids take since there is no vaccine for children but adults could be vaccinated?
Oh, fantastic. That is herd immunity. You have 20 people in your house, so 6 children, 14 adults. Hey, if adults are vaccinated, they indirectly they pass on the immunity. However, children's are same way. The children's, this kind of a things always shows up in when you take your medical board exams. Okay, so children, they go to a daycare center. They rub their nose, all this, they come back, they share the secretion with the younger kids, they come back, grandpa is visiting, grandpa suddenly develops pneumonia. But the virus was carried from the baby, the child, which is going to a daycare center. So same bacteria is more harmful to the elderly people, it doesn't affect the kids. So indirectly, reverse of the equation, if adults get immunized, children do have their own immunity because it's like a develop a herd immunity. Apart from that, still hand washing, wearing a mask, using social distance will still take us long way.
That is almost related to one of the questions Mr. Nandish ಅವರು ಕೇಳಿರೋದು. Will we have to wear a mask in front? In front of the person who's supposed to go get the vaccinations.
Okay, 2 questions. Are you going to wear a mask? Absolutely. In public, please wear a mask. 6 feet apart, number 1, please wear a mask. If somebody is going for a vaccination, he should also wear a mask before he gets the vaccination. There's no doubt about it. The person who is giving the vaccine is also wearing a mask. So wearing a mask is compulsory. I believe you should keep the mask for a few more months, okay, until we all develop immunity so that we can fight this disease once and for all.
Moving on from the pediatrics, because it's still work in progress. There are quite a few questions about people in India. Can you please elaborate about Covaxin, at the same time Novavax? How is India managing to export to so many countries already? This is Badri from Mysore.
All right, my friend Badri, the question is, I'm more familiar about US vaccines, even though I should keep an eye on the Indian vaccines. I believe they work on the same principle. There is, I'm not speaking, but the information I'm getting it through the news channel is somehow there's some kind of a reluctancy in the population in India to receive the vaccine. That's one. I don't know why. It could be multifactorial. We'll dig into that one day. However, I believe it's similar type of vaccination is practiced the same way it is produced. It's a still messenger RNA. It does work very well, and they're able to export. Yes, probably they produce more. That's number 1. 2, there may be a demand. It may be less expensive than the other brands. And it tells the relation between the different countries around India. The exports and imports do happen. And right now, the information is very limited. I don't want to say which I'm not 100% sure. Certainly, I will address this question during the next session. And is there any difference between different kinds of vaccine from different countries? However, the whole basic principle is messenger RNA, and which it acts like an antigen injected to the body that triggers an immune response to fight the disease at this moment.
There are quite a few travel questions. Vivekanand Shanay ಅವರು ಕೇಳ್ತಾ ಇದ್ದಾರೆ, will I still need to take the COVID test if I have to travel abroad, assuming that I got the vaccination? Again, another piggyback question would be, can I travel to India after taking the first vaccine shot, just in case, I have to go and I could not take the second one?
My friend Vivek Shanai, I haven't received my postal mail because of snow. He works for postal service, so I know. All right. Question, Vivek, the way I look at it is number one, World Health Organization sets the rules for international travel. For example, they say they will not recommending anybody to get a vaccine before you travel. This is World Health Organization, which is a body which looks at all the different countries around the world. Question, if you that will answer. There is no recommendation from World Health Organization that you should have a vaccine before you travel. Question to you is, suppose I get a vaccine. I want to go to India next week or following week. I have to follow the laws of the land where I'm landing. That means Indian government says, hey, if you're coming by Air India, I want a nasal swab 3 days before you leave USA. When you land, show me that document. Plus, they'll check my temperature before they walk out. Even if I say, hey, I have vaccinated, I don't need this, they don't accept it. The reason is I could be a silent carrier. That's number one. So most of the airlines mandates to have a COVID testing done, rapid COVID testing done 3 days before. It should be done 3 days before the departure. Apart from, you'll be checked your temperature in the destination where you land at this moment. What's the other question? I missed it. One was,
can I travel to India after taking the first vaccine shot?
Okay. Yes, you can travel, take first vaccine and travel and come back. However, that's not a prerequisite to travel. That means even if you don't take a vaccine, you can travel to India as long as you have a 3 days prior to departure from here, you tested COVID swab negative test, negative. However, my only question is, you go to India, you want to go for 2 weeks, you get stuck there for 6 weeks, you're going to miss your second shot. So I preferably take both the shots before you want to go to India, in case due to extraordinary circumstances, your travel is delayed. The recommendation at this time is, please take within 21 days if it is Pfizer, 28 days within the 2 injections if it is Moderna. So if it is an emergency, you have to go, I have to go. I mean, you have to take chances. That's the way I look at it.
Another question. When will I get vaccination if I belong to the category 1B? On the same pretext, Prasanna avaru kelta idare, a pre-diabetic with HbA1c as 6, but not taking diabetic medication, can they be bumped up to the priority vaccination list?
That's a good question. This is, if you all look at this, it's all supply and demand. Supply and demand. So when the initial vaccine came in, there was a limited supply. Demand was high. So they made groups A, group B, group C. However, once the new vaccine comes, there are more and more released into the market. I believe the people, everybody is going to get vaccine. I personally believe, listening to a few people whom I know, I think next 4 to 6 months, majority of the people who want the vaccine will be vaccinated. So we don't bump up because, again, there are 2 rules. One is Center for Disease Control. Another is federal government. Third, state government. When they ship a shipment of vaccine to New Jersey, it is the responsibility of the state of New Jersey to come up with guidelines, A, B, C, and D. For example, in particular state, I'll not name it because you may go there and get it. Anybody after 75 gets it. Another state, anybody after the age of 65 is getting it. So it is multiple factors are involved, which includes Center for Disease Control, federal government guidelines and local state government guidelines, which implements the rules. So we have to wait and see how the rules are changing. I believe if the supply is more, the rules will be more flexible. A lot of people will be getting it sooner than anticipated.
So again, same question, like how soon do you expect the rollout to be completed so that we can plan a travel trip to India? Idu Usha Basrur ಅವರ question. ಅಮ್ಮನ್ ನೋಡ್ಬೇಕು ಅಂತ ಅನ್ಸಿದೆ ಅದಕ್ಕೆ.
ಹೌದಪ್ಪ ಪಾಪ.
ಅಮ್ಮನಿಗೂ ನಮ್ಮನ್ನ ನೋಡ್ಬೇಕು ಅಂತ ಅನ್ಸಿದೆ ಅದಕ್ಕೆ.
ಇದು we have Zoom right now. Okay. Okay. So Zoom does it. Okay, that's fine. You want to be there in person. Okay, fine. What I respect is, I personally expect, say by June, around 50% of the population should be getting in. By September, October, I do expect 60, 65. End of this year, we should be 70%. That's my, until unless, if you don't take it, I can't promise that. If you are willing to take it, you should be getting it, at least 70% of the population. And the other thing is, it's free of cost. There is no charge for the vaccine. The reason is, this is the way so that people are encouraged to take it. People who cannot afford, they still take it. That's the reason it's free of cost. And that's the best thing which can happen to human community.
Okay. So again, that was one of the questions, who's paying for this, but then where are they available at this point? Because we've been hearing quite a bit of news about that being available in all these multiple vaccination centers, at the same time, pharmacies and everything. And I think people are kind of getting frustrated with the registration process, which is taking slightly longer sometimes, and they're not sure. I mean, we have heard positive news about that too. Some people have been really happy, but some of them not so much.
I sympathize with everybody. What happens, most of this vaccination is registration online. So suppose ShopRite says, okay, we're opening up, everybody will log in, you get crowded, you can't even move your mouse, it's stuck there. So there is known as too many people logging at the same time. However, what I hear from inner circle is, yes, next 2 to 3 weeks from now, most of the pharmacies are getting the stocks. I don't name particular pharmacy. It could be a ShopRite, it could be a Walgreens, it could be a CVS, or standalone pharmacy. They are getting the vaccination. The reason I say that was, Center for Disease Control did a survey for last year, 2020, how many flu shots were given in different locations. The data is 55% of flu shots were received or given in the pharmacy. It's not in the doctor's office, it's in the pharmacy. It's more easy to reach out, go to a pharmacy, get the shots rather than a doctor's office. So because 55% of the flu vaccines were given in the pharmacy, major decision was made to ship it to the pharmacies and you get it. The best way is log in. I think everybody wants it. So it's like a supply and demand. It will open up. I do expect your local pharmacy should be able to fulfill your needs within the next 3 weeks. Things are slowing down in the sense, there is availability is there. Vaccines are already shipped to the pharmacies. I think you should do very well as far as I believe. I personally believe next 3 to 4 weeks, you should get it in your local pharmacy.
I'm going to combine a whole bunch of questions. I mean, see, what usually happens in a healthcare or wherever somebody has received their shot is they usually have a better option, better chance of being monitored because everybody's right there in case somebody has to have a reaction or something like that. People have been asking, do you suggest that I fast before I go into taking my vaccination? Do you suggest I take my vitamin C for the whole week just to make sure that I don't get these other reactions? At the same time, would you say that I should be going with somebody else? Will I be able to drive back home?
Very good. I'll combine all the 4 questions. I will start from the bottom. Do I go with somebody? Answer is yes. The reason is, one is a moral support. Believe me, if you have a moral support, your spouse goes with you, you feel okay, we'll be talking and take away the anxiety from the person, either the husband or the wife, and you go there, and there is also a relief. Hey, if something happens to me, my husband is there. Something happens to me, my son is there. some kind of a moral support, which really, really helpful. There's no doubt about it. Because it's such a new vaccine, we want you to have some kind of a moral support. 2, if you're taking vitamin C, take it. Doesn't hurt in any way. Do I fast? Answer is no, do not fast. Why? You're going for a vaccination. You know, some people develop a hypoglycemia, low blood sugar. Don't take it. When I went for, I took have a nice breakfast. I carried extra food in case I'm feeling hungry. So I'll carry extra food in case you're asked to stay back for whatever it is. I'll certainly take. I will not fast. Not good. What is the very first question? Oh, taking the vaccination in healthcare centers versus pharmacy. No major relationship. Everything is same. Every place where they are going to give vaccine, they are equipped to handle any emergencies if necessary. That's the way I look at it. So I will not wait. Oh, I'll go to a healthcare facility to do it. Get it in a pharmacy. You'll do very well. Take it as granted. That's the way I look at it.
So one last question related to that, and pretty much I think we are summarizing everything. Is there a chance that I might end up getting COVID as I'm waiting in line over there?
Okay, that's a good one. Don't wait in a line. Wait 6 feet apart. Wear a mask. And all these vaccination centers give you by appointment. They say 8:20, next 8:55, 9:20. Just show up 15 minutes so that you're not like bumping into the next person. Don't go stand in a line. All these vaccinations are done by appointment. You can't just go like, okay, give me a vaccine. They won't give it to you. That's the reason. So the reason they want to give appointment is they want to space out people 20 minutes apart so that they come in, you go get a shot, they observe you for 15 minutes, then you go out, have a cup of coffee, and then go home. So they always space it out, stick to your appointment timing. Okay, if you go 5 minutes late, they don't care, but don't go too much delay. Don't go too early, go there. Stand in line when your time comes. You can go in parking lot, stay early, but when your chance comes, 9:15, show up at 9:15. That's the best way, so that avoid the crowd. Standing in a line will not give you as long as you keep a distance and wear a mask.
So I think that's all, folks, for this week. We know that Google Docs will provide you basic information on everything, but for everything else, you have Dr. Bangalore. So he's been nice enough to share his email ID also. So if any of you have any further questions, please send in an email at onemedicalcare@aol.com. ವ್ಯಾಕ್ಸಿನ್ ಬಗ್ಗೆ ಬೇಸಿಕ್ ಇನ್ಫಾರ್ಮೇಶನ್ ಎಷ್ಟೋ ವರ್ಷಗಳ ಸಂಶೋಧನೆಯಿಂದ ಲಭ್ಯವಿದ್ದರೂ COVID-19 ವ್ಯಾಕ್ಸಿನೇಷನ್ ಸುಮಾರಾಗಿ ಹೊಸ ವಿಚಾರ. ನಮ್ಮೆಲ್ಲರಿಗೂ ಇದರ ಬಗ್ಗೆ ಹೆಚ್ಚಿನ ಮಾಹಿತಿ ನೀಡಿದ ಡಾಕ್ಟರ್ ರಾಮ್ ಬ್ಯಾಂಗ್ಳೂರ್ ಅವರಿಗೆ ಅನಂತ ಧನ್ಯವಾದಗಳು. ಇದರಿಂದಾಗಿ ವೀಕ್ಷಕರಿಗೆ ಕೆಲವೊಂದು ನಿರ್ಧಾರ ತೆಗೆದುಕೊಳ್ಳಲು ಸುಲಭವಾಗಿರಬಹುದು ಎಂದು ನಮಗೆ ವಿಶ್ವಾಸವಿದೆ. We trust that you'll be able to now make an informed decision about COVID vaccination for you and your families. But I just also wanted to let you know we are all in this together. Hence, we at Brindavana wanted to inform you that we've created a Brindavana Health Support Group. Please reach out with any health-related concerns. You can message any one of us or email us at arogya, aarogya.brindavana@gmail.com. So thank you so much for joining us live. Iga Super Bowl ge ready agi Chiefs mask hakkondo Buccaneers jote Tampa agiri. Social distance maintain ಮಾಡ್ಕೊಂಡು game ನೋಡಿ, but enjoy your Canadian weekend at halftime. ಧನ್ಯವಾದಗಳು.
Very well said, Archana. ವಂಡರ್ಫುಲ್. ಡಾಕ್ಟರ್ ಬ್ಯಾಂಗ್ಳೂರ್ ಅವರೇ, ಥ್ಯಾಂಕ್ ಯು ಸೋ ಮಚ್. ಬಹಳ ಅದ್ಭುತವಾಗಿ ಮಾಹಿತಿನ ನೀಡಿದ್ದೀರಾ ಇವತ್ತು. ಸೊ ನಮ್ಮೆಲ್ಲರಲ್ಲಿ ಒಂದು ಭಯ ಭೀತಿ ಇತ್ತು, ಏನು ಹೇಗೆ ಇದು ತಗೊಂಡ್ರೆ ಹೇಗೆ ತಗೊಳ್ದೇ ಇದ್ರೆ ಹೇಗೆ ಅನ್ನೋದು. ಇವಾಗ ನೀವು ಹೇಳಿದ್ದೆಲ್ಲ ಕೇಳಿ ಒಂದು ಧೈರ್ಯ ಬಂದಿದೆ. ಸೊ ಇವತ್ತು ಎಲ್ಲರೂ ನಾವೆಲ್ಲರೂ ಬೇಗ ರಿಜಿಸ್ಟರ್ ಮಾಡಿಕೊಂಡು ಬೇಗನೆ ಹೋಗಿ ವ್ಯಾಕ್ಸಿನ್ ತಗೊಳ್ಳೋಣ ಅಂತ ಒಂದು ನಿಶ್ಚಯ ಮಾಡಿದೀವಿ. ಹಾಗೆ ನಮ್ಮ ವೀಕ್ಷಕರಿಗೆ ಸ್ಪೆಷಲ್ ಥ್ಯಾಂಕ್ ಯು, ಸ್ಪೆಷಲ್ ಧನ್ಯವಾದಗಳು. ಬಹಳ ಕ್ವೆಶನ್ಸ್ ಬಂದಿದೆ ನಮ್ಗೆ, ಎಲ್ಲವನ್ನು ಇವತ್ತು ಅಡ್ರೆಸ್ ಮಾಡ್ಲಿಕ್ಕೆ ಆಗ್ಲಿಲ್ಲ. ಆದ್ರೂ ಡಾಕ್ಟರ್ ಬ್ಯಾಂಗ್ಳೂರ್ ಅವರು ಖಂಡಿತ ಒಂದೊಂದು ಪ್ರಶ್ನೆಯನ್ನು ನೋಡಿ ನಿಮ್ಗೆ ಉತ್ತರನ ನೀಡ್ತಾರೆ. ಅದು ನಿಮ್ಗೆ ನಾವು ತಲುಪಿಸ್ತೀವಿ ತಪ್ಪದೆ. ಮತ್ತೊಮ್ಮೆ ಅರ್ಚನಾ, ಯುವರ್ ವಂಡರ್ಫುಲ್ ಮಾಡರೇಟರ್, ಬಹಳ ಚೆನ್ನಾಗಿ ನೀವು ಮಾಡರೇಟ್ ಮಾಡಿದ್ದೀರಾ. Highest form of gratitude and respect to all you healthcare workers. Archana is one of the healthcare workers, and the two of you have worked, and I think many of our Brindavana members who are in healthcare. ನಿಮ್ಮೆಲ್ಲರಿಗೂ ಶತಕೋಟಿ ಧನ್ಯವಾದಗಳು. You stood like pillars and worked throughout the COVID period. 2020 was a year where we had to, embrace all the change, reinvent ourselves, and then record time alli, vaccines na invent ಮಾಡಿ ನಮ್ಮ ಮುಂದೆ ತಂದ ಎಲ್ಲರಿಗೂ ಶತಕೋಟಿ ಧನ್ಯವಾದಗಳು. ಮತ್ತೊಮ್ಮೆ ಪ್ರಗತಿ ತಂಡದ ಪರವಾಗಿ ಡಾಕ್ಟರ್ ರಾಮ್ ಬ್ಯಾಂಗ್ಳೂರ್ ಅವರೇ, ಥ್ಯಾಂಕ್ ಯು ವೆರಿ ವೆರಿ ಮಚ್. ಥ್ಯಾಂಕ್ ಯು ಅರ್ಚನಾ. ಥ್ಯಾಂಕ್ ಯು ಎವ್ರಿವನ್.
All in this together. So
happy Sunday everyone.